My name is Chioma Okafo, and I'm a country program manager on the Achieve project with Pact, based in Washington, D.C., but currently in sunny Abuja. Thank you for joining us. Today, we'll be discussing innovations in community-led monitoring for OVC and DREAMS programming, presented by the Achieve Nigeria team, as well as Michelle L., who was our consultant in the development of the CLM Toolkit. And she also worked closely with the core design team across Pact programs and also the Achieve Consortium. Today, our objectives are to share the theory, process, and tools developed for the community-led monitoring, along with insights and new learning to support OVC DREAMS practitioners integrate CLM into their day-to-day programming. And as we commemorate World AIDS Day this year with the theme End Inequalities and AIDS, it's important that we highlight the growing inequalities and access to essential HIV services. And I think this timely session will discuss methods of getting input from recipients of HIV services in a routine and systematic manner that will definitely lead to action and change. So I think for me, that's all I'm gonna have to say for now. Just a quick run through of the agenda though, and a little bit of housekeeping. I think everyone is muted automatically, but if you do have want to come off mute, please indicate that, and our comms officer who's on the line as well will unmute you. As well, Michelle will begin the session with lessons and insights in adapting CLM to the context of OVC and DREAMS programming. Then we will have our first round Q&A. So feel free to drop questions in the chat while Michelle is presenting, and I will be monitoring the chat, and we'll spend about 5 to 7 minutes on that Q&A section. This will then be followed by a testing exercise where you get to use one of the tools, and Michelle will elaborate further on that when we get to that point in the presentation. We'll then hear from the Achieve Nigeria team and take a deeper look into the pilot experience from Nigeria and proceed to a final Q&A session that covers strategic choices and emerging issues in CLM for OVC and DREAMS programming. So without further ado, I'm going to hand it over to Jen Mulick, the Achieve Project Director, to kick us off.
Thanks, Chioma. I'm so happy to be here today. Thanks for joining us. I'm the project director of the Achieve project. It's a USAID funded global project implemented by Pact with consortium members JPIGO, Palladium, YHER, and No Means No Worldwide. Pact began our work with PEPFAR in the Community Reach project, which started in the very early days of PEPFAR and ended back in 2010. After reaching hundreds of community-based organizations in over 20 countries with grants focused on HIV. Pact just celebrated our 50th anniversary, and the cornerstone of our work has been in capacity development with local organizations. Achieve's current work focuses on OVC and DREAMS programming while strengthening systems and applying our approach to capacity development. Our activities are largely centered around the household, the community, health facilities, and schools. As an organization and a consortium, we focus on reaching adolescents and children with HIV services, empowering them, and fostering thriving, resilient communities where those we serve are heard, capable, and vibrant. With this in mind, and with the support of our AOR at USAID, we were able to utilize central funding under the Achieve project to launch a toolkit for community-level monitoring. We hope that these tools will foster energized engagement and feedback from local communities we serve and those that you serve. The US government's theme for World AIDS Day 2021 is Ending the Epidemic, Equitable Access, and Everyone's Voice. We hope that these tools, which are meant to be used off the shelf, will assist you in implementing projects that incorporate the voices of the people we serve. Now, I'm pleased to hand over to Michelle L., who worked with several of Pact's field teams to develop and test these community-level monitoring tools. Thank you.
Great, thank you so much, Jen. It's really exciting to share with you guys the toolkit that we've been developing over the last few months, along with the training guide. So diving right into the process, I want to recognize that this was a process that was developed across countries. And I want to recognize the members that we worked with along the way, including the team from Nigeria. We were 8 countries working on this process together, and it was quite an intensive process. So walking quickly through some of the milestones over the last 4 months, when we started this process, we knew we had a very short period of time to learn as much as we could about the origins of community-led monitoring, what were some of the best practices behind it, what were the tools that were already in use, but also then look at how we needed to adapt it and what we could learn from within the space of OVC and DREAMS programming. I'm excited to say that within this 4-month intensive period, we were able to conduct literature reviews, conduct a survey, hold in-country consultations, as well as pilot the tools with over 120 stakeholders. So through this process, we're going to share a little bit of the findings along the way, because we're recognizing that this is a new space in our programming. So to begin taking us back to June earlier this year, when we launched the survey through ovcsupport.net, we received about 42 responses from mostly sub-Saharan Africa, but other regions as well. Also, it was a chance to really hear from national and international NGOs, a few CBOs and smaller organizations as well about how they were engaging communities in monitoring services. And essentially what we heard is there was already a rich practice to draw on, and this reflected our own experiences as the core design team as well. Communities are being consulted around routine M&E, observation, reflective sessions. But through that process, what we also learned is the overwhelming challenge that we are all encountering is getting actionable feedback. We were getting a lot of feedback around the nature of the services that we need, the nature of the services that communities desired, but getting actionable feedback to improve the services, to adapt the services, we weren't asking those kinds of questions. And so there was a range of other challenges that were shared there, but this was sort of our marching call in terms of the shared challenges and how can we respond to those together. And so when we asked also in this survey, what should we do going forward to ensure and support widespread CLM adoption? What we heard are, the summaries at the bottom there is just strengthen and build on current practice, help communities understand how we can jointly use data to improve services, but also really help to promote and build a culture of data use. And so through that survey, we learned and we gained access to some additional CLM resources and materials, but we also cast a wide net and reviewed over 40 publications, research toolkits, and other guidelines. Basically, what we were trying to learn from and leverage was experience, of course, focused on community-led monitoring to date, but also different sectors that we could draw on in terms of learning how best practice around client community leadership to improve services and best practices linked to changes in behavior and practice. And here we drew on appreciative inquiry, social and behavior change, continuous quality improvement. It was really a way of borrowing from different sectors to really supplement what we were learning from and seeing in community-led monitoring as it's being practiced. What I should mention is while we had a range of definitions linked to a process of using data to improve and advocate for service improvements, it's important to also recognize the origins of CLM, linking it to improving the quality of services and support to enhance HIV treatment continuity, and recognizing the critical aspects of advocacy, especially among key populations and people living with HIV. So it's natural that the roots of CLM did have, in some cases, an adversarial element to it, and it was often conducted outside of day-to-day services. And so all of this is to say is we had a rich set of resources and guidance to draw on. So in terms of the definition, guiding principles, and recommendations from practitioners, we documented those in a series of very short briefs, some of them just 2 pages long, but it was a way for us to sort of consolidate the learning across the core design team and really reflect on what should CLM be in the space of OVC and DREAMS. And here's where I want to really appreciate Achieve and USAID for giving us the space to really innovate. And here we looked at what should our theory of change look like based on CLM in this space? Who's the audience and what's the approach that we should be considering, recognizing that we're relying on volunteers to deliver and to sustain services? And then also with that, what should the tools look like? And so here I'm pleased to share with you the toolkit the definition that you'll find in the toolkit that we developed. Borrowing again from the origins of CLM, is we defined it as a process that values community feedback and ideas. But we've added here noting that it's focusing on especially beneficiaries, their families, and service providers, actively encouraging them to reflect on their experiences before, during, and after services, and sharing their feedback and ideas in order to adapt services and support to achieve the best possible results. So what does this look like in terms of principles? Again, building on the origins of CLM, it's people connected by geography, shared interests and norms. Taking action, but we're emphasizing here a caring, supportive, and respectful relationships. Also focusing on collecting, interpreting, and using data, experience, and feedback. And then we've added a second M here, and really the idea of building momentum around engaging the heart and spirit to work toward the best possible results. So this is again going to the edges of innovation, I would say, is that we're really talking about engaging the heart, looking at the caring responses that we already see led by volunteers in the space of OVC, but how we can really recognize that, but also leverage that to reach even better service outcomes. And so when we talk about drawing on the best of what people know and care about, here we're really talking about reflection, connection, dialogue, and action. And you'll see those 4 elements across all of the steps and all of the tools. In the next category of focusing on multiple levels, here we really focus on the socio-ecological model that we all know very well in the scope of our programming, looking at what's happening within, but also the interactions across those levels. And with this, of course, focusing on what's happening before, during, and after services, because we recognize to be able to apply the knowledge, to be able to apply what they're learning and put that into use, it really does require a supportive environment. And so this idea of reflection, connection, dialogue, and action, it's something that we're looking at happening within each of the levels and across the levels. Getting and inspiring thinking around what are our personal goals and priorities against the current situation, but also where we want to go. And this idea of thinking about what do I need to do to get there? Not thinking of it from the perspective of a program's going to choose for me, but me as an individual. What can I do to get there? And so this again links to then meaningful connection so that we're promoting a caring and supportive response. And with this also dialogue so that we're encouraging a safe space around experience, ideas, and solutions, along with the urgency to inspire action. So just inspiring that caring response. And then, of course, with this thoughtful and deliberate actions across multiple levels and actors linked to a shared vision of what could be. And so in a perfect world, what we're working towards in the spirit of localization and the spirit of local capacity strengthening is things and efforts and attitudes that will be sustained well beyond the life of our programs. And so this is where we come to our theory of change. We went through a lot of different iterations on this. But ultimately, what drove this toolkit was the thinking and the theory that if we support OVC and DREAMS, service users and service providers to catalyze the best of what they each know and care about, and if we build energized relationships within and among these groups and the wider community, together with positive attitudes, dialogue, and commitment toward better outcomes across the service continuum, then communities will create the conditions for proactive, spontaneous, and continuous efforts to maximize service quality, impact, and reach. And so those elements of meaningful partnerships, community ideas and feedback, positive attitudes, spontaneous initiatives, that's our framework for organizing and testing the tools. During the pilot, we decided to cut some tools, and we continue to refine the tools based on that theory of change. And so in the toolkit, you will see that we have 12 tools, again, linked to each of those elements of the theory of change. There's worksheets, discussion prompts, journal pages. There is a survey tool and there is a questionnaire tool as well. But you'll see a lot of these tools are about influencing practice. And so working with some of the core design team members, we said, okay, what were the most impactful tools, or what were the tools that we were most excited about through the pilot process and through our own experience implementing programs? And there's 4 that we're going to highlight today within the toolkit. The first is building a culture of engagement for CLM, which I'll introduce and we'll all actually get to test out, interestingly. And then we'll also review journal pages, a reflection tool, as well as another reflection tool focusing on service providers. And so before we get into a chance to test out one of the tools, I think it'll be really helpful to look at this from the perspective of different tools for different audiences. So we've got a tool specific to managers and leaders, some for service providers, some for parents and caregivers, and some for youth. It's not expected that each group will use all of these tools, but again, looking at your context, looking at the situation, what are those that resonate most with you? And these here are just some simple thumbnail views of the 5 tools that are available for managers and leaders, some of which are also available for service providers. We're going to focus on one of my favorite tools, which is building a culture of engagement around CLM. Now, this is on page 27 of the toolkit, and what you see here is 1 page of instructions. This is standard for each of the tools. It's 1-page instruction, and typically a 1-page tool. In some cases, it's a 2-page tool, but you'll see it's spaced for entering the information. In each of the sections, we provide those common steps that you saw: reflection, connection, dialogue, and action, as well as some background to explain the why of the tool, but also how it could be adapted. So for our purposes today, and I think Chioma is going to post this into the chat, we're going to do a modified version of building a culture of engagement for CLM. And basically, we're just going to answer 10 questions anonymously and online, but a way to test out the tool for ourselves and gauge where we are. So I'm going to invite everyone to look at in the chat for the link, but it's also posted here. It's a Microsoft Forms link, and we'll pause and we'll give people about 3 to 4 minutes to respond to the questions. Again, I want to reassure you there's no right or wrong answers, and your feedback is anonymous. But essentially, when you click on the link, you'll see that there's a series of questions where you can rate. Very little is number 1, number 5 is very much. And then we'll actually step back for a few moments and we'll look at the responses coming in. They'll be consolidated anonymously, but it'll give us a chance to get a sense of the readiness for CLM. So we'll pause here and give everyone a chance to click on the link. If you need help, feel free to direct message Chioma or myself, or Manji and Victor will be able to be on standby to give you a hand.
Hi everyone, I've placed the link to the form in the chat, so you should see a Office Forms link as the final message in the chat. So please go ahead and click on that.
Great, and I see the responses are starting to come in already. Great, we've got 10 responses in so far, so I think we're going to get a few more, and I'm going to actually share my screen in one moment here as we're going through. Okay, great. We've got more than half of us, I believe, who've responded. So I'm going to share my screen again, and we can actually look at the responses. Okay. So I'm just going to refresh again one more time, but you should be able to see the results tallied in MS Forms. So on the first question, so feel free to continue to post your responses. We'll refresh as we're going periodically just to add in those additional responses. But we have really good responses in terms of how well do you feel you understand the program vision and goals. Out of 5, the average score was 4.19. To what extent do you feel your work is important for achieving the program goals? Again, really high scores here. This is excellent, 4 out of 5 on average. Do you feel your skills and capabilities are being fully utilized? Here we see a 3.75 out of 5. This would be a great question to want to unpack a little bit more if we were one team implementing a program is, ooh, this is a space to have more conversations. Because again, this speaks to opportunities for engagement, adaptation, and improvement. Do you use and suggest, question 4, do you use and suggest innovative ideas at work? The average number here was 3.8 out of 5. That's another interesting one to unpack a little bit more. What does that mean to us as a team? Again, if we were one program, and what might we need to do to create space for more innovative ideas to come forward? What might we need to change or adjust? And then question 5, to what extent do you feel like your ideas and suggestions are listened to and considered? And again, oops, we're just regenerating here, 3.6 out of 5. And then this is a beautiful one. Do you enjoy working with your team? 4.28 out of 5. Question 7, overall, how would you rate your level of confidence in performing the work you've been assigned to do in the program? An average score of 4 out of 5, that's excellent again. Do you receive feedback that inspires you to do better work? Question 8. That one was also quite good, 3.79 out of 5. But again, there's some space to unpack that a little bit more and what might be needed in terms of thinking about how we could be communicating differently and better across and within the team to help people to get that feedback that they need. And then question 9, this is also quite impressive. Do you have data to track the progress and impact of the work you do? The average score here is 3.6 out of 5. And then the last score here, or the last question, was really just looking at the different levels of those responding on this particular survey. So this is an example of a tool that is formatted in Microsoft Forms, but you could also use the paper format if that's preferred, and there's technological limitations. But you can see right then and there, in the space of 1 minute, pretty much most people were able to respond to the questions, and we were able to get a sense of what's the temperature, what's our level of comfort in sharing ideas and feedback. And to me, that's a really powerful way to start and continue on a program when you're thinking about how do we create space for community feedback and ideas. And the premise behind the theory of change was, it starts with making sure our own teams are comfortable and our own teams are ready to share and comfortable in doing so. So the next tool that we're going to look at, I'm actually going to turn over to Manji Ephraim Renchwat, who's our Nigeria project director and a key champion throughout the process when we were developing the toolkit. So Manji, do you want to share one of your favorite tools from the toolkit? Over to you.
Yes, thank you, Michelle, and hello, everyone. I will be sharing on the tool, Appreciating Good Services. This is one of my favorite tools. We piloted this among civil society organizations here in Nigeria. And why this tool is one of my favorites is because it provides the opportunity for beneficiaries, that includes youths and then caregivers, to have a voice in terms of providing their feedback on the services that they are receiving from these case workers and then community volunteers. And this also helps in promoting and maintaining what is working well. The tool, Appreciating Good Services, is also a reflection tool, and then it focuses on the positive. So it also helps in bringing attention to these case workers and community volunteers that are making a positive difference in the community. In terms of the tool structure, the tool contains an instruction page that shows clearly the rationale, an overview, and then the clear steps that needs to be followed. And this is in line with the theory of change and focuses on the key elements and sequence of reflection, connection, dialogue, and then action. Here we also have a mini view of the tools. Next slide, please. So in terms of the main content of the tool, in terms of reflection, the tool provides that opportunity for beneficiaries to think about services that are being provided, which ones are special to them, and then why these activities are also meaningful and what makes it important to them. So it provides this opportunity for beneficiaries to be able to interact in a small group and then share their feedback with the entire community or stakeholders, where they connect and then dialogue and talk about key issues around what will happen if attention is being brought on the key services that the project is being provided, the project is providing, and then what will happen at the community level if they share their stories around what is working well on the project at the community level. This will ensure that whatever is working well is being sustained and then promoted at the community level. Then the next step or sequence is action. So the tool also outlines clear examples and then steps that will help these beneficiaries, either the children or the caregivers, to show appreciation by providing feedback to the service providers at the community level. Examples that we have on the tool includes keywords around how to show appreciation, and then whether they are going to be using letters to show appreciation for the good services that are being provided in the community, and then whether they are also going to be sharing, ensuring that at the community level, the certificates are provided to show appreciation to the service providers, and then whether there's the opportunity again for the community to appreciate these volunteers at any kind of community or cultural gathering. And again, during the pilot, part of the feedback that we got from the community is that this tool is critical because it deliberately ensures that they have a voice by providing their feedback on what is working well. And then on their part, they remember to show appreciation to the service providers because it inspires them to continue to do the good work that they are doing. So this tool, Appreciating Good Service, is one of the many tools that are part of the toolkit that we piloted here in Nigeria. And I'll allow my colleague Victor to talk about the next tool. Thank you.
Okay, so thank you, Manji. And good afternoon, everyone. Good morning, colleagues all over the world. So I'll be talking about the tool, my plan, progress, and commitments, the journal pages. So for me, this is one of my favorite tools, and the tool is used among youth and can be administered in groups during sessions, or also at individual level. This is one of the tools that can be administered during sessions with youth and can be administered either in small groups. It can be administered at a point of service provision. And I consider it one of my favorite because the tool inspires the youth to think about their goals, their progress, and how the program, in this case, Achieve, can support them to realize their goals and connect with the service providers and their community to get the best possible results from the interventions. Now, the tools also, like Manji mentioned earlier, have the steps. And for reflection, it gives the youth opportunity to look beyond the program or have a bigger picture beyond the program to ask what they are most important, what they consider most in their life. I mean, they are in terms of their goal, and then what they're already doing that's moving them towards the direction of their goal. Then you also help them to think around what obstacles seem to be in their way, or what they could do about those obstacles. Then for connection, these are literally questions the youths are asking from what we also interact with them in the field. It also asks questions like, who are the people they connect with in the family, in the community, and even in the project that they can turn to for guidance and support. Then it also goes further to ask them to identify who they are and ways they could reach out to these people who can support them or provide guidance to enable them to achieve their goals. Then we also go back to reflection, to also ask questions around helping them to think about the time they did not get the help they needed to achieve their goal, and also look at what they thought contributed to the situation, how they could avoid this from happening in the future. So these are things that the tool help them to reflect on. And then about the actions, the youth were able to also look at how the program could help them or could be a game changer in their life, considering the challenges and the connections and the thoughts so far. How could the program, in this case, as I mentioned, Achieve, be a game changer in their life, and what would they do to get the most out of the project or the service being provided? So part of the feedback from the pilot in Nigeria revealed that the youth are really excited about the tool because it makes them feel they can determine the cost of the support they receive from the project. They feel they can express themselves, their desires, and be supported through to achieving those desires. And then also there's that excitement they feel for being involved in what happens in the project and a contribution to the final outcomes of the project. So this is one of the other tools that can be used among youths in the CLMM. So I'll also hand over to Michelle again to take us to the other two. Thank you, Michelle.
Great. Thanks a lot, Victor. Ordinarily, this next set of slides would be presented by Ijema, but due to other reasons, she's not able to join us today. But the tool she wanted to share and she asked to present today was the monthly review and reflection tool. And this is something that could be used by service providers independently, in pairs, or integrated into, for example, a monthly review meeting that we often have in our programs anyways. And the premise or the thinking behind this tool is that service providers have so much information and experience that could inform key program improvements. And if we're asking the right kind of questions, we can celebrate the good work, but also support learning and adaptation, not just driven from the program, but also at an individual level. And so this tool is located on page 31 and 32 of the tools. Again, one page instruction, one page tool. So the first question for reflection is, how do you feel about the services you provided this month? And again, you can imagine how easily this can fit into a regular framework of meetings. What are you most proud of? And then having some sharing around that. What are you struggling with? Again, sharing around that. What do you wish you could try or change? And again, this is the new types of questions that we're bringing in with CLM, different from the way that we've engaged communities in service monitoring and service providers. And then this last question we particularly love is this idea of encouraging people to think about what they can do. In what ways can you grow your knowledge and skills in these areas? So again, if a person is doing this individually, they have that space for reflection and are identifying solutions themselves, but even in a group format or at a program level, it also can generate some really rich reflection and thinking. And then connecting this to connection and dialogue. What are your clients telling you about the services and support you provide? The most helpful feedback you received. And again, this is typically in a monthly format. The most hurtful or challenging feedback you received. A third question in this family of questions is the most confusing feedback you received. And why do you think clients or beneficiaries responded in this way? And I can tell you from experience now, working 19 years in East Africa, these are the kinds of questions, even before we were developing the toolkit, that I've used in my own programs. And during the pilot, it was reinforced that there are really deep ways of asking questions that lead to aha moments. And a safe way to do it is to start off by saying, this is some of the feedback I got this month. Help me understand what it means. So it's not always putting the service providers in sort of the sense of driving the conversation, but also making yourself vulnerable as you use a tool like this so that you're creating a safe space for sharing. And then of course, again, going back to action. How can you use this feedback to improve services and support? So again, the way that we've internalized and we're putting forward CLM and the tools is that we're looking at it from the perspective of each of us across each of the levels, using the feedback, using our reflections to really seek improvements in services and support. And this tool is part of 3 other tools to focus on positive attitude and dialogue toward a better collective future. So you can see we're not only focusing just on the positive, we're bringing out the other elements as well of where we need to improve, where we need to learn, where we need to grow, but trying to do it in a way that celebrates the work and encourages people to reach higher. And so for our last 2 slides here, good, we're ending early, so we've got lots of time for questions and discussion. When we're thinking about in our own lessons in adopting and adapting CLM and OVC Dreams programming, we need to really recognize that service quality is driven by actions and interactions before, during, and after services. And so with this, we need to focus not just on the service provider and the client, but across the socio-ecological model in the space of OVC and Dreams. We also want to embrace CLM as a practice to promote reflection and building energized relationships towards what could be. So oftentimes, I think in the space of our program, we look at this and we say 12 tools, oh my goodness. But in effect, as you saw from the examples we shared today, so many of these tools just could be regularly adapted into practice and really just become part of the work we do and the culture of the way that we work. And so with this, influencing culture, we're focusing on needs, perspectives, and desires of both beneficiary and service providers across the service continuum. Because again, recognizing the community nature of our work, we're really looking to sustain and inspire that goodwill and that voluntary spirit. And then finally with this, we sought through this process to be very bold and look for those opportunities to get that feedback in the moment and encourage immediate response. And so this is where we really want to emphasize this idea of leveraging those opportunities and really building that practice of getting that feedback and empowering the service provider and others to support immediate responses to that. So I'm going to wrap up here and then we open it up to questions and discussions, but just to say that we have a toolkit, we have a training guide, and then we have 4 training videos that are essentially just like PowerPoints that you click play and they go. And so they really are meant to be a practical, simple set of tools that you could integrate into your program. I know that Achieve will be sending out these materials to everyone in the session, but please do feel free to share these broadly. And we are so excited to be sharing our experience, sharing the tools with you, and wish you continued luck in your programming. So I'll stop sharing here so that we can open up to questions. And maybe while Chioma is putting that together and we're giving everyone a chance to put their questions in the chat, one of the questions that naturally comes out in all the spaces, and I'd love to invite the team from Nigeria, maybe if you'd like to switch your cameras back on. Do you want to talk about some of the challenges of getting actionable and honest feedback and some of the experiences that we had during the pilot?
All right, thank you very much, Michelle. In terms of the challenges of getting honest feedback for the pilot, I'm not sure we got a lot of challenges. This is because we were able to engage with beneficiaries that are adolescent boys and girls, caregivers, and then the service providers. I think generally they were open, and this is simply because from the entrance meeting and then the background that was provided, the tools being developed are all aimed at ensuring that we improve the quality of the services that are being provided. And then with this background, they felt it is important and critical that they open up and share things that they feel are really working and what they appreciate. And then whatever is not working well, they also were able to share that openly, since it's aimed at addressing those issues to ensure that we improve on the quality of the services being done generally. And I think there was a lot of excitement around the tools because they are very simple, they are user friendly, and again, anyone can pick it. And then it provided an opportunity for them to think deliberately, to be able to use those tools and provide feedback to the case workers or community volunteers, as well as the staff from the CBOs themselves. Thank you.
Great. So I see a couple of questions. Go ahead, Chioma, please guide us.
Yeah, so there's a question here from Sarah Sadiq. It's kind of similar to what you just asked Manji to respond to, but basically she's asking, how can we reassure and encourage health staff to use this form and be open and honest about the negative feedback they might have received and not fear retaliation from their management or supervisors?
So maybe I should respond on that and just clarify that, you know, within the development of these tools, we were really focusing on community level services and support. And so maybe that's the starting point that I should mention. I think what I can say from experience in trying to create a safe space for, you know, negative feedback to be shared is it starts with us as leaders setting that tone. And I kind of hinted at this when I was talking about this idea of being prepared to be vulnerable. And I'm trying to think of an example, but like, you know, not to call out my donor, but, you know, if I've received feedback from USAID saying, you know, the case management tools have delayed too long, and the success of the program is going to depend on our ability to really get the stakeholders together to move this forward. I mean, that's an example of constructive feedback, but it's an example of how I share that with my team historically in past programs to say, guys, we have a problem here and we need everyone on deck to help solve it. And so that's an example of how, you know, you're creating the culture. The other thing I would just say is it's about the language that we use too. And so as we do surveys like the culture of engagement, and we see that we might not have very high levels of comfort in giving feedback, or we don't feel comfortable innovating, those are spaces for conversation again, to say, okay, our results were like 3.6 out of 5. That's not, what do you think that means? And so again, it's not looking at it as how could you rate the program in this way, or how could we get a rating like this? But again, it's about, what do you think this means? And what do you think we need to do? What do you think we need to change? So again, it's that culture. So I think that responds to the first question, but of course, if you want us to circle back, feel free. Chioma, do you want to guide us on the next?
Yeah, sure. So the next one's from Gretchen. She asked, I'd like to know if you've used the CLM tools as part of your child safeguarding efforts.
So I'm not doing direct implementation at the moment.
Yeah.
I'm on a different program, but and I know Manji, you're a technical assistance provider. I don't know if we have experience yet to date on that.
I'm going to say no. On my side, I think that we are just obviously rolling out the tools right now. We've done the pilot exercise in a few countries. So potentially that might happen, and I'll let perhaps Manji and the team address how that can be done.
Thank you, Chioma. Generally, because what we've done is just pilot with civil society organizations that are working with the local partners we provide TA to. From discussions during the pilot, basically there are intentions around integrating this because they've already conducted a series of training on child protection and then child safeguarding for their beneficiaries. But they saw a lot of positive things from these tools that will support their beneficiaries to also be able to reach out and share some key issues that they feel are confidential with these caregivers, to be able to guide them in ensuring that they get the required support. So basically, part of what we have in our plan is to provide an orientation and see how this can be rolled out among the ICSA partners. So we've not gotten to that level where we can be able to have direct answer to this kind of questions, but certainly there are intentions and then discussions around this. Thank you.
Chioma, can I add something to what Manji's just said? I'm trying to go through the toolkit. There was one of the ways that the tools could be engaged in safeguarding. We should mention that we did try to design these primarily more for youth, so age 15 and above. But one of the ideas that came out from Eswatini and Namibia was the suggestion that some of the tools could actually be printed and kept next to the confidential suggestion boxes at some of the service sites. So this could be a way of getting confidential feedback in a very targeted way on some of the services. And there's a particular tool, but for some reason I'm not finding it right now in the toolkit, that speaks to a happy face rating, where you can see a series of different emoticons, and you can talk about, this is where I would say you have a bit more space to go into levels of dissatisfaction or levels of concern. I should say that one of the tools during the pre-test did bring out some emotions, and it wasn't expected in any way, but it was more of the young person was reflecting on their situation and feeling like, wow, would they really achieve their goals? And yes, they're grateful for the support of the program, but they felt like they had such a long way to go. And so it's a little off of the safeguarding element, but it just speaks to how the tools are creating a space for collecting that kind of feedback.
Okay, just in the interest of time, I think we can take one more question. So I'm going to take the one from, let's see. David Akwan asks, good presentation, maybe I missed this. How simple is the process of analyzing the findings from the tool by local organizations, since it may be collecting more qualitative data?
So sorry, my connection was a little bit unstable. I just caught the last part about qualitative data.
Okay, so the question is, how simple is the process of analyzing the findings from the tool by local organizations, since it may be collecting more qualitative data?
So that's I'm so glad you asked that question, because these were some of the trade-offs that we had to choose in our design process. And even we saw this during the pilot, where in some cases the tools were handed out and then collected back which is typical of what we do in an M&E setting. And actually what we're trying to put forward with many of these CLM tools is actually we're not collecting the tool back. We're actually trying to inspire a practice and inspire a readiness to answer questions. And here, one of the learnings that we had from the pilot, to just backtrack a little bit, is that depending on levels of education, and culture and power dynamics within the context, some people just aren't ready to give feedback. You know, so this question of actionable feedback is they haven't been ready to recognize that, oh, I might be asked some of these kinds of questions and I should be ready to respond. There hasn't really been that that practice, I can say, in the education systems, but also in the nature of our programming. It's been more of what do you need, not necessarily how could we make this even better. And so we made the conscious decision that when you look at the tools, the majority of these are really meant to foster a stronger connection. So it's a smaller group sharing with the idea that we're creating ripple effects of change. And as we see that progress happening, we're recognizing it, we're calling it out, but we're also trying to encourage others to learn from that and follow it. There are 3 tools, if I'm not mistaken, within the toolkit where you could be aggregating them in terms of collecting the written feedback, like I mentioned in those survey boxes, or in a particular quarter, focusing on a particular service at a particular area and collecting that feedback back. I would say, based on the findings from the initial survey that we did, this aggregation of data is still a challenge. And I think that's still something that we can't yet address into the toolkit, but just to say that I think this is where partnerships and support will be needed to read through the response. And so with that in mind, this is the power of maybe a smaller sample of information, where just like today, we're looking at the feedback and saying, we got these different sets of feedback. What do we think that that's telling us? And what do we think we should do with that information? So just to say, I think there's a lot of space to grow on how we support local organizations to consolidate the information, but ultimately what we're looking at is information we can encourage communities to use now, actions they can take now without waiting for a program to say, we should try this or we should do this.
Thanks, Michelle. I think we have a little bit of time to take some more questions. So I'm going to take one from Chris Ogar. The question is, how has the use of the tool been? I think you all have talked about this a bit. The second part of the question is, did we use interviewers to collect information, or were the beneficiaries / caregivers able to provide information directly into the tools?
Manji, do you want to respond to that one?
Yes. Thank you, Chris, for the question. So we actually engage with the beneficiaries directly ourselves to get feedback on the tools. We did that in Adamawa and then Kano states. We worked with 2 civil society organizations, and then we interacted and engaged with caregivers, adolescent boys and girls, as well as staff from the civil society organizations. So we engaged with them directly, looking at the tool, and then they provided feedback directly. Thank you.
Okay, thanks, Manji. There's another question here from Christopher Agada. What are the roles of community stakeholders in CLM in a program that is donor-driven? Are there indicators for the effort and the feedback process focusing on stakeholders' role?
Okay, so for Agada's question, generally, because we are just piloting, and then the toolkit is being developed for use by different stakeholders. It is at the level of the implementing partner to determine what part of the tool works for them and how they intend to use that, which component of the toolkit is relevant to what they do and how they can use it for their programs. In this instance, we know that every project has different tools that are being developed and shared by either the donor for their use. So we don't intend to have these ones replacing what the donor has given, but it's for us to look at the entire component, look at what we feel is important, what is relevant to the work that we do, and use it accordingly. That is also part of the feedback we got while piloting with the civil society organizations in Nigeria. Generally, they saw a lot of different components of the tools as being relevant, and we left the tools with them so that they can also use it on their own. And just yesterday, somebody sent me a message saying that one of the beneficiaries sent him a message, a thank you message on World AIDS, which is very inspiring. And then again, the person said he should expect another message on Christmas. And it's because of the good services that are being provided at the community level. So generally, these tools are user-friendly because with a clear understanding of the different components of the tools, it makes it easier for the beneficiaries to begin to use those tools. Most of the tools we have at the project level are tools that are meant to collect our own data as partners or as IPs for our own reporting. But this one trickles down to the beneficiary to also be able to plan for themselves and then also provide input that will help in improving the quality of the work that we do, as well as motivating those that are providing the services to us. I don't know if this answers your question. Thank you.
Thanks, Manji, for that response. I don't see any more questions in the chat. So I don't know if there's any more that folks want to answer. We still have a bit of time if there are. And I'm also dropping the links to the training videos so you all are able to access that. And we'll also share that via email as well after the webinar is over. Okay. I do see a few raised hands. I'm not sure if those are the folks that asked questions in the chat or if this is new. So if a hand's raised, Jackie, if you want to go ahead and unmute, or they can drop the question in the chat, whichever their preference is. Okay. I mean, we're happy to close early.
I think there was a question there that came up from Chris regarding literacy levels.
Okay, and I must admit that. There it is.
Yeah, I think it just came in after the last link. And I think, you know, this was an area of challenge because even in the pretest, Nigeria did translate the tools into the local language. And actually Rwanda too. And we were surprised that even when the tools were in the local language, there still were some accessibility issues. This was particularly the case for the parents and caregivers. So I would say that even when we are translating to the local language, we still present some possible challenges in terms of barriers to use. And so this is where, again, pairing, being very thoughtful about where you want to roll this out. And so, for example, this is where, again, you know, you could look at your program data and be very smart about how you want to use CLM strategically. So, for example, if there are particular districts or counties where you see that an intervention is just not lagging or is just not progressing the way that you expect, you might want to set, and this is where again you can be really thoughtful about, I'm going to turn off my video, sorry, because my internet connection is unstable, but this is where you can be very thoughtful about making sure that you're reaching people who are both literate and low literate and adjusting the methodologies. So in those cases, this is where also Manji's team, when they were doing the pilot, they had engaged some of the local networks for people living with HIV to help them to administer some of the tools. And I have to tell you, when I think about how CLM could grow in our space and in our programming, that to me is a whole other way of helping those local networks and local organizations to have a new level of relevance, because they'll have data to advocate, you know, drawing on what we learned about the origins of CLM. So just to say that low literacy levels are a challenge. And at Achieve, we had talked about making the tools available in Microsoft Word and PDF. so that if you do want to translate and make them available, it's easy for you to do so. But just to highlight that facilitative aspect might be needed, particularly for low literate groups.
I actually have a question for Manji and the team. Knowing that there are other OVC Dreams programs that are actively scaling up CLM in their projects, what advice would you give them after this pilot experience?
So Chioma, because this is going to be the first time this toolkit is being rolled out, I think the advice will be to kind of share learnings and experiences with different stakeholders and then different country offices, so that we can also use the learnings for our own interventions. For instance, in Nigeria, we know that there has been a discussion with USAID. We understand there is a CLM version being implemented with health facilities. And then we've had discussions around seeing how we can also engage and share what Pact has achieved, has been able to do, so we can work with OVC stakeholders in the country to adapt and then roll out. So generally for me is to share learnings so that we'll continue to improve and ensure that at the community level, beneficiaries also have a say in promoting and influencing the quality of the services that are being provided generally. Thank you.
Okay, great. Thank you, Manji. There's one more question in the chat. CLM somehow is expected to be independent of program implementers. Is there any defined guidance around ensuring that this significant aspect of CLM is maintained during the rollout?
I'd be happy to try to speak to that first, and then Manji and Victor, please do feel free to jump in. This is the challenge, and I think one of the things that we were noting when we were piloting and doing some of the initial consultations was, one step removed in terms of the feedback. So, for example, in some sites, what they were saying, because you didn't have the service provider who was actually administering the tool, but you had like the technical advisor who would typically overseeing that service for the program, administering the tool with the clients. Number one, the beneficiaries saw it as an even further validation of the importance of their feedback. And so that one step removed, even just that one step removed, was a way for them to feel like their ideas were valued and that they had a chance to share feedback and perspective on what could be improved. So just to say that that's one avenue, is just that simple one step removed. And then Manji perhaps could talk a little bit about engaging some of the local networks as they did in Nigeria. I think that that's a really great way to go forward in terms of, again, having that independent feedback to collect the feedback, but just to recognize that this really is about changing practice and norms, and the culture of feedback still might be something that we need to build. But Manji, do you want, or Victor, do you want to add more?
Yeah, so my response to that basically is, I would rather suggest, considering the fact that, of course, behavior of people who have administered the tool can play a big factor, particularly in making the response subjective and also creating bias in the feedback that we get. I'm also responding to this relative to Agada's last question. Okay, so ways to ensure that sortings are minimized. I think partners who use these tools could be able to decide how they apply the tool, but bearing in mind the purpose of the tool, not to find faults, not to discredit their effort, but basically to get learnings and use that learning to improve whatever they are doing. So if they have the resources, they could engage external individuals trained to do this to ensure objectivity in deploying these tools. But if the partners will have to deploy the tools by themselves, then they really need to decide and have that quality assurance process that will show that whatever they get from the stakeholders actually represents the quality of service they receive and could be used to make informed decision. So to me, I think the basic thing here is one thing to do is to look at, do they have resources to engage external individuals to carry out this exercise for them? If they do, fine and good, they could train them to go ahead and do that. But if they don't, then they need to agree within themselves to look to administer it. Bear in mind that they must not create an avenue to get subjective response or biased response. Thank you.
Thanks, Victor, for responding to that question before I even read it out. So thanks for that. Any final questions from the group? Otherwise, I think we can go ahead and close out the session.
So maybe just to add to what Victor just stated, for Nigeria, we know we have plans to maybe have an orientation with the local partners we work with on the toolkit. Another approach we're looking at is working with the networks that are working with orphans and vulnerable children here in Nigeria. We have AON and then CPN. These major networks are part of our thinking to share the toolkit with them. If possible, have an orientation on its use and then have all members utilizing SEAM. This toolkit is also going to be very relevant and important to the government. And then they too will be carried along in all the processes. Thank you.
Thanks, Manji. Before we close out, I wanted to give Manji and the team and Michelle a chance to give any final thoughts or reflections.
Great. I wasn't anticipating having time to do that, but what I can just say is this has been such a fun and challenging project at the same time, because it was a chance to really think about the tools that I want to use when I was implementing a program like 10 years ago. And all I can say is that this is so much about the way that we work that creates the space for the feedback and ideas to come forward. And so I just want to emphasize that I'm so excited to see this journey unfold, because I think we're going to learn and become better managers through the process. We're going to become better people at using feedback, but also we're just going to be able to inspire more leaders to lead in the process. So as you test out the tools and as you get new experience and suggestions, please let's keep sharing and let's keep that learning alive so that we can keep getting better at the way that we work, because I think that's really the stage that we're at now. It's refining our practice so that we really are bringing out the best at the community level. So just wishing everyone good luck and saying thanks in advance for sharing the learning and the suggestions to keep improving in this space.
Okay, so for me, I'm very much excited about the tools. In fact, being the fact that it kind of gives more context and more focus to what we do. And I believe as partners, when we roll out these tools in our programs, it's helped us to, guide us to be able to provide activities or interventions that are more impactful, that respond really to the needs of the beneficiaries we work with, and also help us to improve our intervention. So I really hope that we will embrace these tools and use them for the best of the people we work for. Thank you so much for the time.
All right, so for me, generally, like I stated, I'm excited because for the two partners we piloted with, we're beginning to get feedback. People are beginning to use some elements of the tool and providing feedback. So it's very exciting. Looking at the entire content of the toolkit, I know that a lot of successes will be coming from our programs. So I'm looking forward to learning about the different successes from using the toolkit. I know very soon we'll begin to see a lot of thought leadership products from different countries, different programs, even abstracts from different interventions. So it's generally exciting that this is starting now, and we're looking forward to seeing the results in the nearest future. Thank you.
Wow, thank you so much. And thank you everyone for joining today for this really valuable session. Of course, as COVID-19 is continuing to rage and challenge, and in some cases even overwhelm health services, I think this toolkit will be really instrumental in helping practitioners really understand and take action in looking at the impact of the pandemic on people living with with HIV, and just working to make some adjustments in real time to ensure that there is ongoing access to and uptake of prevention and treatment and care support services. So again, as Michelle has mentioned, we will be sharing the meeting recording with participants, as well as access to the full toolkit and videos on how to utilize them. I have dropped them in the chat as well. Of course, if you have any questions, please reach out to Achieve in the email that was provided in the webinar registration for any details. And thank you so much for joining. We're happy to give you 15 minutes back of your time, and stay safe. Thanks, everyone.